So I think one of the things we always want to do is put in perspective, why do we do what we do? You know, being in medical devices, being in healthcare, you have to ultimately think about the patient every day. So what gets you out of bed? What is your purpose? What is your passion? And we thought one of the things that, just to put that in perspective, would be to follow a patient journey around innovation. I'm going to introduce the next panel. We have Dr. Jeremy Mercuri, who you heard Dr. Thomas talk about, Dr. Lawrence Boyd, and they're going to introduce this new technology that's coming out that's been born out of Clemson. So we'll turn it over to you two guys.
Now, thank you all for being here today. How's everybody doing this morning? Everybody can hear? All right. I don't have to make you do jumping jacks to get awake, right? Okay, awesome. Again, my name is Jeremy Mercuri. I'll introduce myself in a second. But I did want my partner in crime here, Dr. Larry Boyd, to introduce himself really quickly.
Thanks, Jeremy. Hey, welcome everybody. Thanks for coming. If you're an MN student, raise your hands. Okay,
Right.
good. Thank you guys. Thank you. I'm Larry Boyd. I've actually been in the medical device industry for about 35 years. So this is a symposium that is near and dear to my heart. It's something that I've spent my whole career in. I currently direct the Master of Engineering program, so I'm filling some pretty big shoes over here. I also am a professor of the practice. And so we're going to tell you a story about one of the projects that came out of the Master of Engineering program. And I think it's going to really tie together a lot of different aspects of what is a really powerful community that we have here in Clemson and in the area. So we're looking forward to telling you that story. But again, my background, 35 years in medical devices, worked in a variety of companies in spine and orthopedics. Oh, okay. Can you hear me okay? And really just bringing that to bear, bringing what I've done for years and years to teach students and make them industry-ready engineers. That's really our focus with the Master of Engineering program. So turn it over to you.
Awesome. Thank you. And again, as you know, my name is Jeremy Mercuri. I'm also a professor of practice in the Department of Bioengineering. I was very fortunate to get my master's, my PhD here at Clemson, then went on to work for two of the world's largest medical device companies, Medtronic Spine & Biologics and Stryker Orthobiologics. Then had really a once-in-a-lifetime opportunity to get invited back to teach and to run an academic research lab in the Department of Bioengineering. So I was there, tenured faculty for 11 years. And just recently stepped away a full-time job now out in Greenville with a startup company called Samaritan Biologics. But again, I still get to come in, I still get to teach in the MEng program. Larry has done a great job taking over the MEng program and directing that and really taking it to another level. So I'm really looking forward over the next few years to see where the program goes. So, so great to be back here. But we wanted to play a video really quick before we actually introduce really the star of this panel. It's not Larry and I. It's actually Adam Gorlitsky. But if we could play the video, that'd be wonderful. All right. So I'd like to welcome Adam Gorlitsky to the front of the room here. Well, thanks for being here, Adam. Really appreciate you being here. A little bit about Adam's story. I actually got the fortunate pleasure to meet Adam probably about a year and a half ago. Actually, one of my former students, not Vishal, actually another PhD from my academic lab. He emailed me, said, hey, there's a guy in my running group that's got this really interesting idea. He's got this really cool device, and it may be a good project for the MEng program. He thinks he wants to improve it a little bit. And I said, okay, well let me talk to him, and actually met him out on the ICAR campus. So again, one of the innovation campuses that the university has. And he was actually already doing research with a faculty in industrial engineering. They were doing actually some kinematic studies. They had them all suited up with some sensors and stuff like that. And so I kind of watched Adam kind of go around the room, and I said, yeah, I think we could try to come up with some ideas. And again, depending on what his vision was, to maybe try to improve the system that you see. And this is actually the first system that he brought and showed us. And so Adam, could you tell us just a little bit about what was the initial vision to really engage the MEng program, the students? What did you want done with this?
So first, I just want to say thank you for having me. How's everyone doing today? All right. Well, a little more excitement. No, what was the initial spark? Is that okay? So I've been using that powered exoskeleton, the one that you saw in the video, for the past 10 years. Mostly doing it for road races. I have 2 Guinness World Records. I have a nonprofit called I Got Legs, where we help others get access to these exoskeletons. So the initial spark was how do we increase access to exoskeletons? that's like goal number one always. And then two was our point of view with increasing the access, and what I'm talking about right now is over the past 10 years of working within my nonprofit and helping people get access to these exoskeletons. So as I was saying, it's to increase access. And then our point of view with that is to turn exoskeleton racing into a Paralympic and collegiate adaptive sport. So I found this device right here in Poland. I paid, if you guys really want to know, you can ask me off stage, but I paid a little money, got this one. I described this is like the 20% molded ball of clay, right? It's not, I was like, all right, this is a jumping off point. There's something here. So I guess it initially started there with, trying to increase the access to exoskeletons, turn into a sport, and like an official collegiate Paralympic sport. And but it all started with this 20% molded ball of clay, and then working with the program to help take it to the next step, which we'll be showing you guys here shortly.
Awesome, very cool.
So, one of the things that we want to talk a little bit about is the MEng program. And, Adam came to us with a particular need. We're fortunate that Dr. Mercuri met Adam through another Clemson resource. We've had several teams of students actually work on this, and you can see some of them up here. We had sort of a first wave of students that came alongside and did this as kind of a side project. And then we had sort of the second group that actually did that as a formal project as part of the curriculum. Really a key part of the MEng program is to have project-based work that's done in teams and kind of carries through all the classes that we have, okay? And so the team that you see here on the right with Professor Demanda in the red, who's another part of our faculty, came alongside Adam and really met with you, I think probably weekly essentially, to kind of go through your requirements. And you had this as a starting point and you came to the students and said, these are the features that I really need to see in a final product. Do you want to talk just a little bit about kind of how you interacted with the students? One of them's here today. I told him I'd call him out. Hugh Mitchell, are you here? Hugh's back in the back there. So he was part of that team that was taking this to sort of the finish line as part of the class.
Yeah, so I guess the MEng it's a 1-year program. So I guess the first semester was kind of preparing, getting everyone ready to then create the next, or the blueprint for the next prototype, which we'll show you here shortly. It was kind of doing all the pre-work, and then the spring semester is, so fall semester was the pre-work, and then spring semester was just meeting weekly with the students, or I should maybe like once every 2 weeks. And it was all about, our point of view with it was to essentially create the blueprint for the next version prototype. And then once the spring semester was over, Larry and I met, or had been meeting once a week to create this next prototype and to take it to the next level, which I guess is forming like an actual business and a company around it.
Yeah, yeah.
Really a great experience. So the previous picture that you saw, the students, that was early last fall semester. So again, with our students, it's really important to get them in front of the stakeholders in person. So not only did they get to meet Adam, this was out at the QBINC, the Clemson University Biomedical Engineering Innovation Campus out at Patewood Hospital. So Adam was gracious enough to come out, let our students, he's like, hey, why don't you guys get in this thing and try it? And that was pretty eye-opening. I got into it and tried it. And so again, just getting that firsthand knowledge of, okay, what are we working with here? Where do we see some opportunities for improvement? So it was pretty cool to have him out there and actually try this on. So,
one of the things I was talking with Hume about when he came in is, having somebody like Adam involved in the project intimately, right? The students go out and they do voice a customer, but to have somebody like Adam who's an integral part of the project day in and day out, and we've seen that over the summer as we've had meetings with various investors, physical therapists, others. Having Adam at the table has really been critical to the project. And one of the things you can see here is Adam's vision for what is a very different product category. It's not a robotic exoskeleton like he uses, very expensive, has some limitations, needs a walking partner, but it's not a wheelchair either. This is a mobility device that has some real benefits. And so Adam and I have been working over the summer to kind of understand the positioning of this design, and this came out of actually a partnership that we had with a design firm. So I will mention, we were very fortunate. There was a Relentless Challenge grant that Clemson secured through the Department of Commerce and CURF matching. And so we had some funds that we could actually use to come alongside a design firm, because this is a pretty extensive design for a student team to do. So they actually guided the design firm with Adam's input to come up with this first design, functional design that we were going to move forward with. So we're really grateful to see that kind of come together. The financial support allowed us to do really more than we could with a typical student design project. And hopefully in the future, we can always have some funds available for certain key projects to put a little bit extra in to help advance them more rapidly than we would with what are typically relatively limited funds for a student design project. So, let's just kind of give you guys an update on kind of where we are. So this is sort of the positioning. This is the final design that the students came up with the assistance of the design firm. And these are really some of the key features that Adam wanted met. Do you want to talk a little bit about kind of some of the key things that you wanted to see going from what you have today to where we're headed?
Yeah. So, okay. So the main problem with the powered exoskeleton. So I always start with like the psychological experience first, and then kind of work backward from there. So my thing is with the powered exoskeleton, what I don't really like about it is that it's very reliant on a walking partner. So what what do I mean by that? It's kind of hard to talk about fully unless I can show you. But with the powered one, I need somebody behind me helping me stand up. I kind of need, I don't want to say I need someone glued to me the entire time, but I kind of do in certain moments. So what happens is it leads to walking partner burnout. With the powered exoskeletons, everyone like myself will use it, all day, every day for like the first 3 to 6 months. And then after that 3 to 6 month mark, the usage rate just starts to plummet. So, and there's a reason for that. And I think in large part, it is because of the walking partner. Walking partners get burnt out. My walking partner is my dad. I had an ex-girlfriend become my walking partner. That got a little weird. She's great, by the way. But it can get a little weird. Yeah. If you're not like the greatest boyfriend, she'll like use it against you. But and she'll be the first to admit that. We're like still really very good friends. But no. So okay, to bring it back to the initial question, I want to get a seat. So I wanted to make it more independent. Okay, all that story was to tell you about that. Make it more independent with a seat. So the current one that I'm using, I guess I can get into it myself, but it's still, getting out of this back into my wheelchair is hard. And just like the powered one as well too. So the first thing was to put a seat on it. Second one, I don't know if you guys noticed me walking with this, just, that 10 feet. But when it's on carpet, it's not the greatest. It's kind of hard to use when it's on carpet. Now around, this kind of slick floor right here, it's works great. But I'm, pretty good shape. So the second thing that I wanted to do with it was to make it easier for the average person to use. So the next design has these elliptical kind of style movement. So yeah, seat, elliptical style, power mechanism. And then this one doesn't have brakes. So that's the third thing, is we're going to put brakes on this next version. Because as you can imagine, if you're on the, like you're trying to go around here in Clemson, there's a lot of hills. You're going downhill, like you're totally screwed. So yeah, seat to make it more independent, elliptical style drive mechanism to make it so everybody, the average person can use it, and then a brake mechanism for safety. So
awesome. Let's look at some of the further design iterations. So this is actually the design that we have been fabricating. And so you can see on the left there is sort of a test frame. That's the front portion with the drive mechanism. And I'll show you actually that machined component. As Adam mentioned, the overall unit does have a seat with a lifting capability. Right now that's manual. So everything about this is completely manual. We were fortunate to find a manufacturer actually in Spartanburg, South Carolina that did the machining. They did the laser cutting, they did the welding. And so Adam and I were actually kind of high-fiving each other the other day when we actually saw this assembly of parts on the left become an actual functional unit. And so, to get to that point, this was probably about a month ago. We wanted to make sure that the front half was going to be fully functional before we built the back half. And so right now we're making the complete posterior component with the seat and all those components. We should have a functional unit, we hope, by mid-October. So we made really good progress. And Adam and I spent a lot of time over the summer. We visited Zima. We were fortunate through Matt to get introduced to Michelin's Mobility Innovation Group, and they made some connections for us on some of the cool tire technology they're working on that might fit. We actually pitched at a venture conference on Tuesday, match day for Next Gen, and got to get to know the Greenville community a little bit better and making connections. And so I'm really fortunate that we were able to get as far as we have been with non-dilutive funding. And hopefully we'll have other chances to fund it through various grants and foundations, and hopefully SCRA will give us a little bit of money. And so that's kind of a quick update on where we are with that. We wanted to give you a few minutes, Adam, to kind of talk about your bigger vision. As I've gotten to know Adam over the summer more closely, and we've gotten to kind of share our dreams, Adam's really shared with me what's a broader vision. I'm an engineer. I'm focused, like, this is what I want to make. Adam is thinking much bigger than that. So I want to give you a minute or two to kind of talk about your vision.
So now this, if there's any way we can maybe back up the slide a little bit. I mean, not back it up, but shrink it. They're just missing half the stuff here, but it's all right. It's all right. All right. So real quick, I'm an artist at heart. I want to describe myself as a scientist. I'm an artist at heart. So everything. So what do I mean by that? So everything I do is self-expression first. So everything comes down to how I feel when I'm in this exoskeleton. I don't feel disabled. I don't feel able-bodied. I feel what I call re-enabled. And all that really means just re-empowered, right? So every time I get into this exoskeleton, I feel re-empowered every time. And like I can take on the entire world, So I want to leverage that brand, that mindset into a company called Legs Medical and create essentially 5 divisions. Now, look, we're not doing all these divisions tomorrow. This exoskeleton right here is the first step. But it's very important for me to articulate this to investors and VC firms, because we're not just doing one project here. We have a whole vision. This is my 30 to 40-year vision right here. I'm not building this thing to sell to Medtronic. I mean, that's no, I'm building this thing. It's the rest of my life. So short term, I like to use this exoskeleton that we're creating to create the Legs Mobility division of Legs Medical. And then from there, I got a lot of stuff I want to do with AI, pharma, neurotech, robotics. But it's a 30 to 40-year vision that all starts with this one manual exoskeleton. It's exciting.
Yeah. Time for some questions, maybe? Yeah.
So I noticed on the exoglider that you have some omnidirectional wheels on the front. I'm assuming that's for being able to steer that in any direction. I just from my short view of it, what are you going to add to it to be able to steer it?
So this is probably a better question for Larry to answer. But there is a mechanism, but Larry, it's probably better for you.
To steer it. So I didn't mention that, because currently for Adam to turn around with this, he has to use his hips to kind of wiggle and make it turn. But
and we should say that wheel mechanism is not added to this design yet, but it will be by the end of October on the side.
So anyway, just to kind of cut to the chase, there is a mechanism to actually drive the wheels independently. So if you want to turn around using up here, the hand wheels, he can preferentially turn left or right. Yeah, that was a feature. Right now, this unit doesn't really lend itself to turning around. It's kind of an awkward, if you look at this, it's intentionally a relatively loose construction for that reason. Yeah, good question.
Yeah, so we're essentially creating, I guess, 3 models right now. The Exo Trainer, which is for rehab clinics. Now, these 3 models, they're very similar, obviously, just fine-tuned details. So the Exo Trainers for rehab clinics, the Exo Glider is the take-home version, and then the Exo Racer is the one for collegiate and Paralympic sports. So.
Awesome. We're going to hand it over to IV. Thank you, everybody.